Health authorities in the Democratic Republic of the Congo are searching for the people who have been in contact with the 3 Ebola patients who have died in Goma, the capital of the northern Kivu province. The density of the population in an urban setting, the anonymity and high mobility make the search harder.
So yes, we find all the contacts we think we know of, but there are people who hide their illness, who flee, who go to another place, who think that being taken to the Ebola treatment center is like being taken to the death house.
Health officials say the Ebola treatment centers provide patients with a high standard of care and understanding.
They really do their utmost to look after people in a very caring and special way. They keep a survivor in the room at all times with the person who has Ebola so that they know they have someone who really understands what they're going through.
The World Health Organization has stressed the importance of people's cooperation.
Nothing can be done without a committed population, which is why we train people identified by the community to be able to detect suspected cases of Ebola at the community level and also to undertake preventive interventions.
The 3rd reported case of Ebola in Goma, which is close to the border with Rwanda, led to a temporary closure of the border on Thursday.
I'm really praying that they will open this border so that I can go to work in Rwanda where I have a job. I can't understand why they don't just test us instead of closing these borders.
The United Nations has advised against closing the borders because people who need to cross will find another way and more likely spread the virus.
This is actually not helpful at all if a border is closed, in part because there's really good economic links, but also family links on either side of these borders.
The World Health Organization has hundreds of Ebola experts in the region and says it is bolstering measures to prevent and treat Ebola in the neighboring countries, especially Rwanda, Burundi, Uganda, and South Sudan, which are most at risk. Zlatica, Hoke, VOA News, Washington.